There was a time in the not too distant past, excuse me, when nearly all baby boomers were born in this country that we actually had government-run healthcare, city and county hospitals. If you can bear with me for a few minutes, I will show that even when factoring in inflation, the cost was 2 to 3% of our current healthcare cost, a 97% lower price. I will show why this has happened, give examples such as a total cost for delivering a baby including a 3 day stay in the hospital, for what used to cost just a week's salary back in those days, now costs on average an annual salary for the same thing, wages today. More importantly, I believe that also that I have a plan that progressives and the right can both embrace to reduce cost a minimum of 60% in a very short order. I've waited too long to put this together, so I really need some help in getting this to Bernie Sanders. I've tried, but so far they're so busy it hasn't got to anybody, I don't think. And I'd also need some help with your forum. Anyhow, I'm going to begin my little essay. Starts out a palatable transition to national health care. Every American, Republican or Democrat, is aware of the outrageous cost of health care in this country, not many knowing that it is on average 3 times the cost of the rest of the Western world, or about the mediocre results. Every American, right or left, is also aware that we are an aging population. There's a simple solution that would be most agreeable to both red and blue Americans. It's time to give the private profit control of healthcare a little bit of competition. They don't have any. So we need to give them a run for their money. A brief history. In 1940, only 75 years ago, my sister Joyce was born in Kansas City, Kansas, when it was a required three-day stay. The total cost was $25, which was the average weekly salary in those days. $25. My sister Karen was born the following year. The war in Europe was heating up, the Depression was ending, and a period of inflation was just beginning. The total bill came to $35. My parents were struggling at the time with my father's alcoholism problem, and the bill was never paid. I asked my parents if they tried to repossess my sister Karen, and they said no. Oh, in the extremely rare case, and at least in those days it was a rare case, where a cesarean was to be performed, it was another $12 to $15. You can look up, I was going to send a package, but you can look up to 1947 maternity ward pamphlet. If you have trouble finding it, I'd be glad to pass that on, and I'd also like to be able to pass on a transcript of this if it'll help. But anyhow, there's a brochure for Santa Monica Hospital, 1947 maternity ward. Just Google that, it should come up under the unnecessary website. But anyhow, showing the cost, and again, it's about a week's wages. It was $45, $47 in 1947. Anyhow, in 1955, 60 years ago, when I was born, and with the economic boom of the 1950s, the cost of delivery with a 3-day stay had gone up to $125. At least for my folks, they were in California at the time, and I think they had the Kaiser Permanente, so they actually had the first healthcare insurance where the ball started rolling. Anyhow, the average weekly wage then was a little over $80, so it was about 1.5 weeks' pay. Anyhow, the cost of having a child today, with the silver plan that most insurance companies provide, the average out-of-pocket expenses would be about $6,700 for a vaginal delivery, with an additional $1,500 for it's now extremely common and extremely profitable cesareans. That is the new parent's cost. The total bill with the insurance company share comes to about $30,000 for vaginal and about $50,000 for cesarean. I wonder why the cesarean has become so commonplace. You're welcome to watch The Business of Being Born. It's on Netflix. It tells a little more about this, but anyhow, instead of just only a week's wages, the total cost has now become the annual salary of the average American. Indirectly, we also pay 100% of the cost of the insurance and all the insurance companies' costs and profits within the premiums over time. Is it any wonder that nearly half, or 45% or more, of children are born using Medicaid? Is it any wonder why so many, again 45%, are born out of wedlock? Even with insurance, what young family starting out can afford to pay? Those numbers were brought out by TrueVen. That's a consulting company as to the cost of having a child today. Anyhow, what happened? Where does the money go? The cost of insurance was only one part of the problem. The cost of healthcare is a classic case of good intentions gone bad, much like the recent mortgage crisis and the current costs of higher education. As long as the federal government is willing to write a check with minimal questioning of the bill, the unscrupulous will continue to keep bumping up the charges and continue to cut corners. Excuse me. I'm trying to hurry this up, so anyhow, I'll get it out today. Where is Dr. Jonas Salk when you need him? He literally gave the vaccine for the scourge of the first half of the 20th century, polio, to the world. It was 25 cents per dose given on a sugar cube in the 60s when I was a child. When he was asked, he said that he could no more patent the vaccine than patent the sun. A true patriot, a true practitioner of Judeo-Christian values. We need to look in the mirror too. The attitude most of us has had was, don't worry about it, the insurance will pay most of it. Or don't worry, the employer share pays most of it. Not realizing that money could be a raise in pay instead of just going to premiums. Or listening to the news about healthcare costs going up and not questioning it, just accepting it as a matter of life, fact of life. It's true that we now have some fancy equipment and there is a cost of malpractice, subject we can get to later, as they're not even remotely as expensive as most people think. Average physician's malpractice nowadays is about $250 a month, believe it or not, but anyhow, I can back that up too as well. But anyhow, let's look now at the hospital share responsibility, starting with another personal story. In the year 2000, my mother, then 79 years old, went in for heart bypass surgery. After the surgery, the doctor said that she was doing fine, that her veins were very thin, and he had problems with tearing when attaching them to her heart. Later that evening, she began bleeding internally from a tear, and the doctor had to go back in and attempt to reattach the vein. After that surgery, the young doctor stated that she was the 8th bypass surgery he had done that 12-hour day. Being a numbers guy, I asked in awe as to, wow, how long did this take for this procedure? The doctor said an average about an hour and a half. Being somewhat concerned even then about healthcare costs, I did some research as to why it was so expensive. Finding out that Medicare paid approximately $60,000 for the procedure at the time, I thought that doctor must be making a fortune. Much to my surprise, with a little more research, I found out that most doctors no longer have a practice, but work as salaried employees of usually the hospital. It's pretty hard to start a practice nowadays when starting with upwards of $500,000 in debt, which is ridiculous, and no clients. You'd have to have another $500,000 to get going, probably. But believe it or not, the starting salary then was about $175,000 per year, advancing over 20 plus years to about $350,000 max. $175,000 divided by 52 weeks comes to about $3,400 per week, or about $700 each day in a 5-day work week. Break it down even further, and he only got about $87 per $60,000 procedure. Even if he only did 10 surgeries a week, or just 2 per day, and not the 8 that he did that day, he would only get $340 each, about 0.5% of the total cost. If each of the rest of the team are 5 or 6 doctors and nurses, that's what it takes on total, got a similar share, would come to less than 3% of the total bill. What happens to the other 97%? Anyhow, again, that is if they only did 2 per day, not 8. It sounds to me like the doctor got taken advantage of too. Sadly, my mother, in reasonably good health when going in, died a little later that evening as the sutures ruptured again. Sadly also, she had not been suffering any symptoms of a heart attack, chest pains, etc., only high blood pressure for many years. I heard recently from a former nurse from that hospital that there used to be a saying, come to the Florida hospital for a toothache and leave with a bypass. Sadly, as there have been for many years peer-reviewed studies showing that people don't on average live any longer with the surgery than with the usual medications, or much better yet, a change to a healthier diet. I have a friend who recently graduated from medical school with about $350,000 in debt and dropped out of his residency program at the local hospital because he could no longer take the way patients were treated. no better than cattle. Run them in, run them out as fast as possible. I take forever to tell all this, but anyhow, not to mention the fact that the hazing process of 80 hours per week, anyhow, when figured out at time and a half for overtime, only came to about $8 an hour, $800 per week, or about $40,000 per year, less than the minimum wage in many states. And of course, as soon as you finish your residency and become a full-fledged doctor, you must show your success by leasing that Jag or Mercedes or Land Rover. And of course, you need that $1 million house. Most people are then trapped, will do what they are told, and keep their mouth shut. It's a rare person that won't, and for his story, I can pass on contact information. And I've been told my whole life, and I think there's a lot of truth to that most doctors are just lousy business people. They're more concerned about what they're doing than keeping track of their money because it comes in pretty easy. But anyhow, how do the hospitals get away with it? Google the most profitable hospitals in the United States. The top article is by Forbes, a conservative business magazine. Do the numbers in the article, and supposedly the hospital industry, or so they say, most operate at a small loss every year. However, many hospitals, for some unknown reason, show huge profits, probably because they were honest in their accounting. Two of the more profitable hospitals in the 2010 article included the Flowers Hospital of Dothan, Alabama, and the Del Sol Hospital of El Paso, Texas, netting after all expenses nearly $1.7 million and $800,000 respectable per bed. They had the greatest profit margin, but there was many hospitals that made more actual dollars, and they list them off in there. But anyhow, over 50%. That is two of the poorest cities in the nation, probably getting most of their income from Medicaid and Medicare. The article shows dozens more hospitals making over $1 million per bed per year. One is $2.37 million per bed. That is $16,000 to $45,000 per week per bed after all expenses, including taxes. Okay. Something that would help show this, why this come about, just do some research on the time, I believe it was, and this was in the 80s, maybe the 90s, I don't know, and I think it was R.J. Reynolds, and I can't seem to find it again, but anyhow, I work 60 hours a week, but anyhow, R.J. Reynolds, the number 2 tobacco company in the world, had their financial records subpoenaed by the U.S. Congress, again, either in the 80s or 90s. They sent a huge convoy of tractor trailers, loaded with receipts and documents. Sadly, everyone in the media thought that was funny, how they're going to audit this. The point I'm trying to make is that it is nearly impossible to audit a very large company. Try auditing something with all the multi-syllable Latin procedures that are in medical billing. If any discrepancies are found, nobody ever goes to jail. If a company is fined, it is just the cost of doing business. Not only are many companies too big to fail, they are also too big to audit. In the hospital business, you can run one of these corporations, multi-hospital corporations, get caught stealing billions from Medicare, and you can later become governor of Florida, only in the United States. The biggest reason for these huge increases is that we no longer have county hospitals, which were government-run facilities that actually did run at a very small loss every year. Does this story sound familiar? That is because we are rapidly doing the same thing by privatizing prisons, as the private sector can do it much more efficiently than the government. Sort of like trickle-down economics, or the mega-rich should be taxed at a lower rate than the rest of us because they are the job creators. Of course, the people that do the physical work or consume their products have absolutely nothing to do with it. Anyhow, how to begin to get back to some government-run hospitals, or all of them, but anyhow. We are already spending nearly $500 billion a year on Medicaid. I suggest we start by using a portion of these funds to either start constructing new hospitals and or to buy up any existing hospitals as they come up for sale. I would put together a panel of retired business people to study the administration end of things from examples of the rest of the civilized world. No longer would 30% or more of the staff be needed to chase down insurance payments or collections. We can also start an aggressive campaign to hire doctors at even 20% or more increase in their former pay, and paying recently accredited doctors the same pay as senior doctors of the status quo. Why should a fully skilled newer doctor doing the same procedures as one of the longer tenured ones be paid half for the same services. I doubt there would be any trouble in recruiting doctors away from their current jobs if we were to do that. I believe that anyone with a 3.5 GPA and taking some advanced classes in high school wishing to become a doctor should have at least half of the tab picked up by the government with the balance paid back over 10 years with no interest. So they could actually have some skin in the game. I have a problem with people getting something for nothing. Sometimes they don't appreciate it, but anyhow, some skin in the game. I'm reading this off the wall. I lost my place. Okay. In time, we could develop our own medical schools. An active recruitment program such as ROTC could really pump up the numbers. The savings we could effect from just a few short years could have us rolling out new doctors in hospitals at an unprecedented rate. There would be competition for staff as well as eventual competition for pricing of procedures for the rest of the public. Once up and successfully running, it would be time to start offering Medicare patients the use of the facilities with no deductibles, no hassles of finding the right co-insurance for medicine, etc. And of course, we would no longer be constrained by the Medicare Modernization Act or the Prescription Drug Act, passed overwhelmingly by the Bush administration, making it illegal for the government to get competitive bids for prescription drugs. This could be a savings of a minimum of 70-80% or more on prescriptions. Once this has taken place, the general public or small businesses could be the next in line to sign up for at least a 50% savings. Larger corporations would then beat up the status quo, or eventually, if they wish, to be able to come on board. If the taxpayer is already picking up the entire tab for Medicaid, as well as the subsidies for Obamacare, there should probably be little opposition on the left for starting with these patients, and let's face it, the right couldn't oppose it with a straight face. After all, anything to save on the cost of the takers. It's time for some competition. Speeding up the process. You want to really put this on steroids and get it up in a couple of years? Studies have shown that the magic number for Americans to begin to balk at the price of fuel is $4 per gallon. That is about the price when the economy begins to falter, people start to drive less, and begin purchasing more efficient vehicles. Right now, the average price per gallon of regular national is about $1.80. I paid $1.50 something the other day here in Florida. And it looks like it's going to hold for considerable time. Sorry about that. The federal tax per gallon is currently 18.4 cents and has been so for over 23 years. It was 18% of the retail price of a gallon when put in place, because gas was around $1 a gallon then back under the Clintons, and only 4.6 of the amount per gallon if we were back up at $4 a gallon. We used to have fuel prices over $4 a gallon for several years under Bush. If it were to come to close to $4 a gallon, oil companies would take a small hit on volume, but still make a killing on margins. Fuel consumption has been around 136 billion gallons per year, and a tax of 50 cents per gallon would generate $68 billion, funding the building of 2,700 100,000 square foot hospitals per year at the cost of $250 per square foot, which I have a friend that's a hospital architect, actually, and that's about what he said a no-frills hospital would cost. And of course, the staffing could be easily paid for with the current expenditures that we already pay for Medicaid. An additional 20 cents or so per gallon sure could help with our infrastructure. Again, the right couldn't oppose it with a straight face, as most of this tab would be picked up by the 99%. The snowball effect of this, combined with the extra dollars brought in by the efficiencies of the new systems, could, within I think a very, very short order, pretty much guarantee most of the health care could be quickly provided for in this manner. The status quo could continue on as before as private providers, funded by private insurance or cash, as in the case of Great Britain, and I think some other European countries. But let's get that money before Big Oil does. Again, at $4, they start balking. We can either give it to the oil companies or we can use it towards health care. Eventually, the difference needed in funding for single pay could be a tiny payroll tax, and I don't think you'd even need that if you just kept it on gasoline. Probably much smaller than the Medicare tax we pay now, which is 2.9%. Or, again, we could just continue on with the gas tax. There'd be a little small cost involved with the loss of people working in the insurance and collections field, but many of those people could be retrained to help with implementing the new system, new nurses, people assisting with care of elderly, etc. And as well as, I'm sure, probably a good many new doctors. All of this will cost money, but much less than we are already spending. It should be a savings of at least 60% once implemented. If put in place, I believe I have an additional simple plan, this may sound crazy, to reduce the cost of healthcare down to about 10% of what we pay now. This will tie in with a plan to maybe reverse global warming and all but eliminate unemployment at no cost to the taxpayer. Now, it sounds like I'm a fruitcake, but this would be a little tougher pill to swallow, where the first one isn't, but I believe it's possible. Anyhow, we can discuss this at another time. The questions we can ask voters. We need to get Bernie to stand up there and shake this copy of the hospital bill, Santa Monica hospital bill, and say, are you tired of trying to figure out which plan is best for you? Are you tired of paying deductibles and copays? Do you think you should have to wait for a referral for treatment or another doctor being predicated by the whims of the insurance companies, who as corporations are legally required to maximize profits? And should you have to choose between eating and buying prescription medications? And what if your health changes? Will your current plans pay for that, or you have to get a new plan next year? Again, wave the Santa Monica hospital bill around and ask seniors if they can remember what it was like when we had government-run healthcare. The money we save from healthcare can go to education. The money we save from healthcare is like a big fat raise in your paycheck. Again, please help me get this message to Bernie or somebody or whatever. We got to beat the drums. Otherwise, we're going to bankrupt our country. Thank you very much for listening. I'm sorry, a little tiny postscript. Anyhow, my name is Tom Gallagher. I'm a 60-year-old guy, small businessman, has a pizza and sub shop in the Orlando, Florida area. You can reach me at 407-844-4937, 407-844-4937. My email address is tmgmktg@aol.com, and I can forward a transcript of this and links to the Santa Monica hospital thing, which is really easy to pull up, and the Forbes article. They're both very easy to pull up. So anyhow, and the other information is True Consulting. It's a hospital consulting company. All right, thank you very much.